Engine 19 is responding to the NBC. Engine 19's on the scene. Got 2 vehicles involved. We'll be out investigating. Engine 19 radio. Here's all the subjects are ambulatory at this time. Hey, Halford, why don't you go check out one person? I'll get great to the other one. Kev, if you would, just check the trucks out, make sure that they're secure. I need you to go over where Halford is and check out the patients and tell me who needs to go to the hospital and who doesn't, all right?
Okay. Hey, Lou, we need to backboard her. She's got some neck pain. She wants to go to the hospital.
Okay, I'll get the rest of the crew.
I gotta get my phone. That could be my daughter.
Man, we're gonna have to hold on a minute.
Somebody needs to get my phone, please.
The straps are all secure, okay?
Y'all keep tightening it, okay?
Okay.
Gotta be secure, ma'am.
Good pulse in the legs and everything. Here's the ambulance. All right. Hey, we got a 29-year-old female that was involved in a 2-car MVA. She's complaining of severe neck pain. We did a primary, checked her out head to toe. Everything's, within normal limits. We got her backboarded, and she's got good pulse and sensory in the distal extremities before and after. So we're good to go.
Okay, thanks.
Engine 19 radio. Engine 19 will be in service. Turning the scene over to PD.
Hey, Lou.
Yeah.
Hey, what do you want me to put this call as? A medical assist metro, EMS, transport, or?
Just put it assist EMS crew because I didn't get any information on her, so that should do.
Okay.
Good morning. Are both sides ready? Ms. Fry?
Plaintiff's ready, Your Honor.
Thank you. Mr. Lippincott?
Yes, Your Honor, we're ready.
Thank you. Ms. Fry, if you call your first witness.
Thank you, Your Honor. If you could place your left hand on the Bible and raise your right hand. Do you solemnly swear or affirm that the testimony you'll give in the matter now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
I need you to introduce yourself to the jury, please.
Lieutenant Chris Sobieski. I work with Cobb County Fire and Emergency Services.
And how long have you worked with Cobb County Fire and Emergency Services?
17 years.
And what is your position with them?
I'm a suppression lieutenant.
Now, are you also a fire officer?
Yes, that would be my title.
Now, as fire officer of Unit E19, are you ultimately responsible for everyone's action on any type of scene?
Yes, that would be my job.
Now, on the date of April the 8th, 2004, did you and your engine crew respond to 1082 Al Bishop Drive?
Yes, we did.
And what were you responding to?
A report of an accident with injury.
Now, your engine company, they assessed and treated my client, Miss Smith. What was her condition when you arrived on the scene?
Ms. Smith was ambulatory upon our arrival.
Were there any obvious injuries to my client?
No, none that were obvious.
Now, Lieutenant Sobieski, could you describe the actions that you and your crew members performed upon arrival?
When we arrived, my engineer positioned the apparatus to maximize the safety of the crew blocking traffic. I delegated both firefighters to check. We had appeared to be 2 patients on the scene. I delegated the firefighters to go see about injuries while I checked the vehicles for any other types of hazards.
Now, is that your general procedure for this type of incident?
Yes, it is.
Now, was my client, Ms. Smith, was she complaining of any pain while standing with you and your crew?
She was complaining, one of my firefighters reported that she was complaining of neck and back pain.
Now, did you perform any other duties for Ms. Smith on that day?
Yes, the firefighter who had assessed her said that we needed to immobilize her and that she decided to go to the hospital. So we performed full spinal immobilization.
I have no further questions, Your Honor.
Thank you. Mr. Lippincott, your witness.
Good morning, Lieutenant Sobieski.
Good morning.
We have heard your testimony, and I would like to just kind of go over it if that's okay.
That's fine.
You stated that you performed a full spinal immobilization and that you also assessed the patient's vital signs. Is that correct?
That's correct.
Okay. Lieutenant, I call your attention to Exhibit A. Is this the incident report you completed for this incident?
Yes, it is.
Okay. The report states that you and your crew were on scene for how long?
22 minutes.
And while you were on scene for that 22 minutes, you took care of Ms. Smith?
Yes, we did.
Lieutenant, is it general practice to document care given to a person on a kind of accident like this?
Yes, I fill out a patient information sheet, and when we get back to the station, I enter it into our fire records management system.
Did you just call the plaintiff, Ms. Smith, a patient?
Yes, I did.
Is that the terminology you use in an accident scene?
Yes, especially when they're complaining of injury.
And so in this incident report you did, what does it consist of?
It's got the patient's name, address, what they were complaining of, the conditions we found, and a narrative, and where we talk about what skills we performed on the patient.
Can you, looking back at Exhibit A, can you show me where it says on there that you've provided for your patient full spinal immobilization?
No, I can't.
Why not? Can you explain that?
No, sir.
But didn't you just say that Ms. Smith was your patient?
Yes, I believe so.
And isn't it standard protocol to create a patient care report every time you have a patient?
Yes, that would be standard.
And aren't those standard guidelines given to you by your department, by the state of Georgia, and by the Federal Department of Transportation?
Yes, in this particular instance, the ambulance crew had arrived just as we were finishing up the immobilization, and I turned the patient over to them, transferred care, and for further treatment and transport.
Yet you never completed a patient care report.
No, not on this particular incident.
According to your incident report, you only assisted the EMS crew, and you were on scene for 22 minutes.
Yeah, that's what I put down was an assist.
So now is it your testimony today that not only did you assess and treat this patient, but you provided full spinal immobilization?
Yes, that's what we did.
Could you please look at Exhibit B, Cobb County Fire Department Emergency Services Protocol number 43. According to your protocol, you are to perform these duties for the plaintiff for this type of incident, correct?
Yes, we were compliant in our protocols in this incident.
Where on the report does it show that you, as an officer of the Cobb County Fire and Emergency Services, assured that these duties were performed?
I always make sure that we follow our department guidelines and protocols. I'm at a loss to know why we didn't, or I'm at a loss to know why I didn't document it.
But you're saying today that you did it?
Yes, I know we did it.
How do you know that you did it if it's not in your report?
Because she was immobilized.
Okay, and what consists of a full spinal immobilization?
We use head blocks, backboard straps, and put the patient on a long spine board.
And you're saying right now today that you and your crew performed this task?
Yes, we did.
And why would you put someone in a full spinal immobilization?
To protect them from any further spinal injury, any movement that would aggravate a condition.
And you contend today that your crew and yourself performed that, even though it is not in your paperwork?
Yes, I do.
Would you say that you ordinarily respond to 100 or more incidents a month?
Yeah, that would be reasonable.
So that would be more than 1,200 incidents in a year?
Yes.
So in 2 years' time, that would be easily over 2,400 incidents that you and your crew went on.
Using those numbers, yes.
And now you would have the court believe that you recall today exactly the treatment you provided over 2 years ago for Ms. Smith.
Yes.
Let me ask you again, Lieutenant. I want to make this perfectly clear. You want this court to believe in your sworn testimony today that you remember things better today than you do the day of the incident when you were in your station writing your report?
I believe so, yes.
Lieutenant, would you like us to believe that you and your crew properly followed the protocol set down by your department on the day of the incident?
Yes, I would.
Lieutenant Sobieski, due to the fact that you and your crew neglected to document the care given to Mrs. Smith, it technically didn't happen. And therefore, you and your crew, along with Cobb County Fire and Emergency Services, are now conceivably liable for the injuries that Mrs. Smith sustained possibly after the accident. You stated yourself you did not document patient care in the RMS system. Therefore, we do not know if Mrs. Smith sustained injuries from the accident or if her injuries are due to the care you allegedly performed. Your Honor, at this time I would request that the witness be excused. I'll be petitioning the court to amend this lawsuit to include Lieutenant Sobieski, his entire crew, Cobb County Fire and Emergency Services, and Cobb County government as defendants in this civil action. I'll be naming these individuals claiming gross negligence, negligence of duty, and violation of their oath of office for their substandard care rendered to this plaintiff in this case.
You can't handle the truth.